kind introduction, and to Professor Tobson for inviting me, and Professor Joka and the whole HCE team for welcoming me here. And I'm really glad to have people here in the room because it makes for a more interactive conversation, but I'm really looking forward to hearing questions and comments from those of you online as well. So thank you, and I'm particularly excited about talking about local issues today, because I think that when we're talking about real big picture issues of resources and energy and climate, thinking about the big picture policy really needs to be informed by how those policies work on the ground at the local level. So I'm very interested in how policy levers get implemented at the local level. The challenge, of course, when you're talking about local case studies, though, is that the context is so different from place to place. So I'm going to share with you some stories from Rochester, New York, which is a small city in upstate New York, 6 hours away from New York City, so it's quite different. And I'll need to provide a little bit of context and try to put that in a setting so that you can extrapolate some of the questions we've asked there and things we've learned, things that you may be interested in, whether they're in other cities, other countries, or totally different issue areas. So here's the title of the talk for today, and you can do the next page. Thank you also for noting that this book, Bridging Silos, was published several years ago, but this happens to be Open Access Week, so celebrating the importance of open access publications. And MIT Press's Open Access program has dedicated their communications this week to Open for Climate Justice. And they've highlighted all the titles that they've published in their open access series that relate to climate justice for the past several years. My book, Bridging Silos, is one of them. So yes, I'm advertising a free book. You can download it for free online. And that means a lot to me because I wrote it to help communities learn from each other about how to solve some really difficult problems. And while it's been reviewed in different journals and that sort of thing, what means the most to me is hearing from community groups that have brought it into policy discussions and their conversations with legislators and their work with each other to solve problems. So I really do hope that it's accessible to lots of people. So the theme that relates to your overall speaker series for this winter is that many low-income and community of color face environmental justice. I think we know this in the global scale and the very local scale, that people who have less money, who've been historically disadvantaged, also bear more environmental risks. And we may refer to those as environmental injustices. And a lot of these issues, in fact, I can't think of any that don't, have a health hazard, a health outcome, something that people experience in their lives, their children's lives, on a day-to-day basis. One of the barriers to solving these problems that I've noticed, and may happen in other countries as well, is that we manage public health and the physical environment separately. There are separate policies, agencies, interest groups, academic departments, right, that deal with health and environment. And I call these silos. They're separated. I'll show you a picture of the image that I use for that. So I think it's really important to think about where are those silos? They exist for reasons, right? We need to specialize in order to have expertise and have the technical solutions, but we also need to work together. How is it that we can bridge those silos in ways that can help us solve problems? Next. So here's a picture of two great silos, right? They are separate from each other. You can imagine one of them is health, the other is environment. You can't get from one to the other because they're completely separate and surrounded by walls. So the point that I like to start with, though, is that public health, the field that I work in most, was originally environmental health, historically. That's where public health started, was in sanitation and features of the environment that hurt people's bodies. That's why they cared about the environment. But as our technical expertise has progressed, we've separated those two things out. So public health focus is more on medicine, and environmental systems are managed separately. And this contributes to environmental injustices where there are gaps between those two. And solving that at the national level can be very difficult, but at the local level, that just doesn't make sense to people. People see that that's a problem that causes problems in their daily lives, and collaborations spring up at the local level that can make a really big difference. So I like to think about how can we bridge silos, particularly at the local level, to try to make a difference. Next slide, please. I say historically that public health was environmental health because if you have ever taken a public health class, you know the story of John Snow and the pump. So there was a cholera epidemic in London in the 1850s. And John Snow, who is a doctor, mapped the cases and found they were clustered around one particular water pump. He didn't know what cholera was. No one knew how germs were spread, but he knew that they were clustered around this pump. So he told them to take the handle off the pump. So that image, the pump handle, is still used as the icon for public health today, even though public health doesn't really do environment. Next slide, please. So public health practitioners, whether they're local or national or global, understand that the environment affects your health through air pollution, sanitation, chemicals, radiation, noise, agriculture, and built environments. But they don't actually control the things that affect those factors. So public health sees the result that this is a map of Chicago and showing that the life expectancy varies by many, many years from one place in Chicago to another. So we say your zip code, which is what we call those, little areas in different colors there, determines your life expectancy. More than genes, more than behaviors, more than anything else. You can predict life expectancy from where you live. Why is that? It's the cumulative effect of all these factors. Public health understands that, but they don't have the tools to affect it. And that's why it's so important to figure out how to reconnect these fields. Next slide, please. So the problem with moving from ecosystem management, where I trained, into public health is that we don't get to show such beautiful pictures. So I put one up anyway. Also, because when I trained in ecosystem management, it was intuitive. We understood that if you want to protect the bison, you need to protect the grass that they eat, the vegetation they rely on, the clean air, the water quality. And in order to do that, you need all of the agencies, all the government agencies that are responsible for each of those things, air, water, land, to work together if you want to protect the bison. That's an important lesson. Next slide, please. That ecosystem managers were really thinking about in the late 80s and early 90s in the US. And a lot was studied and written about how can we get these separate environmental agencies to work together at an ecosystem scale so that we can actually have the outcomes that we want, rather than separated. So here's a book that colleagues and I contributed to based on these case studies that we had done, many of them for our dissertations and early in our careers, that we're learning similar lessons all along, that it was important to get agencies to work together, but there are a lot of challenges. So next slide, please. So moving now into the public health field, I asked, what if we treated public health like an ecosystem? How can we get agencies and groups to work together so that we can have health outcomes for humans that also are integrated and effective? Next slide, please. And if you're going to think about it that way, well, what is the human environment? Homes are a key human environment because we spend most of our time inside them. And it's important to note that many homes have health hazards in them, whether it's with their air quality, things like tripping, falling, fire hazards, or toxicants in the home environment. So housing quality, however, is very difficult for policymakers to monitor, to manage, and to enforce, because it's very difficult to affect what people do with and inside their own homes. It's also important to recognize that dealing with owner-occupied housing or rented housing is very different for that reason. And it's universal, I think, that lower income people are more likely to have hazards in their home than others. And therefore, housing disparities contribute to health disparities. Next slide, please. So with that framework, I want to focus you in on a very particular area, which is health and housing in Rochester, New York. As you can see, it is right across Lake Ontario from Toronto, on the other side of New York from New York City. We have a very proud history of social activism. It was the main working place of Frederick Douglass, a famous abolitionist, and of Susan B. Anthony, who was largely responsible for getting women the vote in the United States. So we have, through our city, running the bridge across our river is the Anthony and Douglas Bridge, Susan Anthony and Frederick Douglass Bridge. The other important thing to know about Rochester is that it's thought of as a pretty well-to-do area because it has a strong industrial history, but that it has declined in recent years. So at its peak, it had 300,000 residents. Now it's only 200,000. It's the third poorest city of its size in the whole country and has the highest rate of child poverty. Next slide, please. And that's largely because Kodak. And so Kodak's slogan was "Picture this." If you're old enough to remember that, it's a little English pun there. The Kodak World headquarters are still in Rochester. They used to employ 30, 40, 50,000 people. Now they employ 3,000. So that loss and the loss of other industries has resulted in economic decline, as in many other Rust Belt cities around the Great Lakes in the United States. Only our decline happened later, and we still haven't recovered. So as a result of that, we have a lot of older housing that's in very poor condition. And as you can see, if you have older housing with old windows, they start to degrade over time when they're 100 years old. I put a yellow star there because I want you to remember this part. Think about that window. It's key to this story. So that there is lead in the paint in these houses that was put there many years ago that is ground into household dust and into dirt outside, which gets into children and causes lead poisoning. So next slide, please. Although we have lots of older housing in Rochester that's in very good condition, we also have older housing that's in poor condition. And because in the United States, we use lead ply in paint until 1978, it was banned in Europe in 1926. This is literally a problem you don't have here like we do, because we didn't listen to the public health experts. You did. That's a whole nother conversation. So what happens is, even when you've painted over this paint, the lead from the paint in older housing, when it's in poor condition, gets ground into the household dust. The normal behavior of children crawling around and putting their hands in their mouth, as children do, it gets into them, it affects their brain, it causes lifelong learning, health, behavioral problems. So this is a map showing that it looks like the map of poverty in Rochester, but what it is the map of the percentage of children with elevated blood lead levels around the year 2000. So the highest red are where 30 or about a third of the children had elevated blood lead levels. Just for context, next slide, please. There is a school in the middle of Rochester where 41% of kids had elevated blood lead levels. The national rate of lead poisoning at this time was 2%. So it was 20 times higher in this school. And that's what got me to transition from an ecosystem management to lead poisoning. This is clearly a problem that was very important and needed to be solved. So the principal of the school where these kids lived, next slide, please, was really shocked because he learned about how lead could affect children's ability to learn and grow and be educated. And he learned that the health department actively monitored children's blood. And when they found a child with elevated blood lead levels, they would go test their house, get their house fixed. Meanwhile, the housing department was inspecting some of these highest risk houses. They would inspect them for things like electrical hazards, safety, other things, but paint was cosmetic. That's just not pretty. Not a high priority. So they wouldn't cite the peeling paint as a problem. The principal who had to deal with the health outcome said, lead is a silent monster that is stealing our children's future. You need to do something different. These management silos are hurting our children. I don't care that that's how you set up. We need to figure out a different way. Next slide, please. So he helped give birth to this coalition to prevent lead poisoning. There was a group of people from the city, from the county, from health, from housing, community groups, educators, lawyers, researchers, who worked together to reframe lead as a problem that was the responsibility of the health department to a housing problem. And they worked, tried to make their decisions based on the best available science, focusing on children's outcomes because they knew that people were concerned about children's education and health. They had a community-wide lead summit to really get people excited about and concerned about this issue. Next slide, please. And as a result, we're able to pass a local law that added lead to those inspections. It said when you're inspecting rental housing, you have to check for lead, you have to address those hazards. Since then, over 160,000 inspections have been conducted. So every house has been inspected at least every 6 years. And you can't study this, as a political scientist, it would be very difficult to study this because many other things are happening in a housing market in a city at the same time. But I can tell you that the lead rate in Rochester came down 2.5 times faster than anywhere else in upstate New York. And the only difference is we had a lead law. Next slide, please. So then the question is, okay, that works for lead, but what about other housing hazards? And at a national level, groups have said, oh, there really are a lot of different health hazards that are associated with housing in poor condition. This idea of healthy homes. Next slide, please. Medical professionals are interested in this as well, because they are aware that, as I gave you the example of lead can lead to lead poisoning, mold can contribute to asthma and other drinking, breathing problems. You have many unintentional injuries happen in the home, especially for children. Electric or gas hazards can lead to carbon monoxide poisoning or fire. And there are many things you can do to address those housing risks that then help health problems or prevent health problems. So there's a big movement to try to figure out how to get health systems to pay for some of these remediations. And I'm going to give you an example of one corner of these kinds of efforts. Next slide, please. So here's just an example in case you haven't thought about these connections before. If you had a flood, for example, or water coming in the roof of the house, that could cause structural damage. And that damage might make it more likely for pests, rats to come into the house. It might lead to peeling paint, which is where the lead poisoning comes from. You could have damage to gas appliances that could cause a fire. Or you could have structural problems that cause people to fall down and hurt themselves. That same mold that is caused by moisture causes mold can also lead to asthma, which is also contributed by pests and droppings. So there are many connections, and that's why we need to think about houses as a whole system and keeping them healthy. Next slide, please. So if you think about the kinds of things you would do to keep a home healthy on this left side, there's a lot of overlap with the things that you do to improve energy efficiency. And all of those have these happy outcomes of cleaner air, reduced trip hazards, carbon monoxide reduction, stress reduction, reducing fire risk, and a big one, saving money. So that's going to be the impetus for this story I'm going to tell you next. So I need to give you a little context about how we try to promote energy efficiency in private housing in New York State. It's possible to call someone up and say, come to my house and tell me what I can fix to save energy. That's free. And then if you don't have a lot of money, you can get a grant from the government to fix some of those things. That funding is available for the kinds of fixes, interventions that are going to have a short payback period. So maybe you spend $1,000, but you save $500 a year. That's a no-brainer, right? That would pay for itself in 2 years. But what if something takes longer to pay for itself? It's lower on the list. It's less likely to be paid for. So here are some of the things that often are done as part of these energy efficiency programs. But window replacement, which clearly, if you have an old window like the one I showed you before, is losing a lot of energy, they're very expensive. So the payback period for replacing a window is often around 20, 25 years. That doesn't make it on the list of things that are going to be fixed. Next, please. So, however, if you remember that window, yellow star, think about that window, there's something else going on with that window. This window poisoned this baby's older child with lead. And so you have to ask yourself, how much is it worth to prevent that child being poisoned? It's not only a question of how long will it take for replacing this window to pay for itself for energy savings. What about the human potential loss, the education, the health benefits, just the ethics of having a child poisoned? So when we combine those two rationales, all of a sudden you have a really different way of thinking about what is appropriate to be supporting in these homes. Next slide, please. So happily in this case, there was a lead poisoning prevention grant that aimed to prevent that baby from getting poisoned after his sister was poisoned, and we were able to get the windows replaced. And it was just a happy coincidence that it also saved energy. Next slide, please. So this idea is embedded in a national program called the Green and Healthy Homes Initiative, which tries to get these streams of government money that care about health and energy to work together. Why don't they do that now? That's the bridging silos part, thinking about the barriers that keep them from working together now when it makes obvious so much common sense to protect that child and save energy at the same time. But we need to think about how can we actually do that? How can we implement that idea? Next slide, please. Okay, so in order to understand the answer to that, I need to tell you a few things about the housing market in Rochester. Feel free to ask me more about this later. But as I mentioned, most of our housing is old in US terms, meaning built before 1970, likely to have lead paint on it. Most families own or rent single family houses like that. They're not living in apartment buildings because the apartments tend to be smaller. And it's a very poor city. So the average cost of the house is around $65,000. The average cost of the house in San Diego at that same time is probably $400,000. Okay, so you can imagine that many of the people who own their own homes are actually quite poor. They don't have a lot of income. They don't have enough money to keep their home up in good condition. In addition, over 60% of the people living in Rochester rent their apartments, they rent their homes. And in some neighborhoods, the highest risk neighborhoods, 85, 90, even 95% of the people are renting these single family homes. There's very little publicly owned housing in Rochester. There's some, and it actually tends to be in better condition. It still has problems, but it's highly regulated, right? So the government has direct control over the quality of those units. These privately owned units, the government doesn't have so much control over. It's also important to know that most people who rent these houses, not so much the apartments, pay for their own energy. So the landlord does not pay the energy bill, the tenant does, the resident. So the Healthy Home and Energy grants that I mentioned, they focus on owner occupants who have low incomes. There are a few grants that are available to landlords, even though that's where the highest risks are. At the same time, we have city inspections, they focus on the rental housing. So another set of silos here to be thinking about. Next slide, please. So this program called Renew started that I'm going to tell you just a little bit about as an example of trying to overcome these silos. Observing that most homes in Rochester are heated with oil or natural gas, so greenhouse gas emissions from that. Many of them with very inefficient heaters, so you could replace them and save a lot. Very few have central air conditioning. And there are energy grant programs that focus on low-income owner-occupants. Those are available, but a lot of times people are not able to access them because there are other problems with their homes. So this program was established to help bridge these different grant programs and provide maybe a little bit of extra money and advice to owners so that they can get the money to fix up their homes and make them healthy and energy efficient. Next slide, please. So Renew stands for Rochester Energy Efficiency and Weatherization, which doesn't make so much sense, but it makes a nice acronym, which is always important, right? Because so it's a collective impact program. So many different existing programs working together to try to coordinate their grants and make more of a difference. They originally started with $1 million grant from the Attorney General of the state of New York and have been sustained with grant funding since then, primarily. And here are some of the health, housing, and community development agencies that participate in this collaborative effort. Next slide, please. This is just to show you that their funding sources come from many different sources trying to braid them together for those goals. Next slide, please. So doing this for the last 5 years, Renew has invested over $6 million into 420 low-income homes in Rochester. Most of their clients are women of color who are single head of household. Most of them have children and earn less than $30,000 a year. They save on average 20% on their energy costs and also report better physical and mental health. And they've been calculating how much greenhouse gas emissions are prevented by this work at the same time. Next slide, please. Here's the list of the kinds of weatherization things that are done in these houses to improve health and save money. Everything ranging from replacing water heaters to a programmable thermostat to ceiling doors and electrical work. So a whole wide range of things, but some of the most common you can see here. Next slide, please. So quick stories. I don't expect you to read all these, but they're going to be on the slides and recorded so you can later as examples, because as a policy scientist, I know that to make a persuasive argument and promote a policy, sometimes telling individual stories is more important than numbers. So this one case, Joyce had problems with her house so severe that her front door didn't work. Her windows wouldn't close. So she slept downstairs because she was afraid someone would break into her house and harm her daughters, and she would never know if she slept upstairs. So she slept downstairs on the couch to protect her family. The grant programs gave her new windows, sealed the door, made it secure, did all these other things. But the main things that I wanted to notice, her stress level went way down because she was able to sleep in her own bedroom and she wasn't afraid for her family's safety anymore. And meanwhile, was saving 30% on her fuel costs. So many different kinds of benefits. Next story, please. So this family and the mom had asthma and she would wake up every night coughing. They got a new furnace that improved the air quality in her house, and she was able to sleep through the night. Her asthma got much better and saved 20% in their fuel bills. Next one. I remember hearing about when Inez got this grant because she was really sad that she couldn't get up and visit with her grandchildren because her boot, this respiratory condition that made it very hard to breathe, was so severe. After doing work in her house, her breathing got so much better that she was able to go to different parts of her house and visit with her grandchildren. And she was also saving 20% in her energy every year. Next slide, please. Okay, so overall, when Renew talks about its benefits to the community, it talks about stopping greenhouse gas emissions, reducing them, to improve overall air pollution, to reduce heat island effects, and also to reduce healthcare costs, to stabilize neighborhoods so people can stay in their homes, and that the cumulative benefits are much larger if you look over time than the costs of fixing the housing. And to also emphasize that these kinds of climate solutions also promote social and environmental justice. Next slide, please. So the way this works, as I mentioned, mostly grant funded, but they're also trying to promote this as a carbon offset fund. Like if you might remember that when you take an airplane ride or you do a lot of other things, you have the option of offsetting your emissions. Maybe that money goes to protecting some forest in Brazil. This takes that money and instead uses it to reduce carbon emissions in homes in Rochester by helping these low-income families who own their own homes. So they said, you can go and calculate how much your annual commute and your home energy costs, and that suggests that each of us could be donating $300 a year to Renew, and that would offset our carbon emissions in a much more homegrown way than protecting forests in Brazil, which is also really important. But think about the other benefits in this city of promoting social and environmental justice. So this idea of offsetting carbon emissions is not new, but doing it in this way at the local level is quite innovative. Next slide, please. So the goal would be, of course, to try to get universities and companies and governments to make donations as a regular course of offsetting their emissions. That hasn't happened yet, but that's a big goal. So overall, this example embodies some of the themes of bridging silos by reframing the issue of energy efficiency to also include health and health equity. That means that it's important when you're evaluating the program to not only collect information on carbon emission, greenhouse gas emissions and cost savings, but also on health outcomes. It also suggests that using both health data and environmental data to target these programs to find where are the people who have the most severe health problems and let's invest in energy efficiency for them is helpful. In order to do that, you need this collaborative effort, and that means people need to show up in order to exchange their resources between their programs. Those boundary spanners need time to do that. And of course, that takes funding to sustain collaboration, which is often very difficult funding to get. Last slide. So I had some thoughts here, trying to go from this very local example to larger issues that you may be encountering in your work or your interests. Big picture, thinking about messaging about policy advocacy is that climate justice is about both social and environmental benefits, and we can see some of the examples here. That these interventions have to do with climate mitigation, but also about adaptation. Now think about the air conditioners, right? If people have no air conditioning and they go buy energy using air conditioners, you're actually making adaptation makes more carbon emissions, and that worsens the problem. Then in terms of health equity, this both promotes health, helps address some of the health conditions like in the stories I shared with you, and also can prevent things like that child getting lead poisoning. In order to do this, you have to really think about what are the barriers to local implementation. They are going to be different from Rochester to Buffalo to somewhere else in New York to a different state to a different country. And what are the relevant silos that are blocking that collaboration in your community? Also, what are the incentives about the people who would need to work together? It's also important to support collaborative structures, especially at the local level. One of my favorite quotes that I ran into when I was writing this book is that collaboration is a dance that no one knows the steps to. Everyone agrees it's nice to dance, but they don't know how. And that quote is actually from forest ecosystem management scholars from the University of Michigan. Then finally, that building and maintaining bridges takes a lot of resources. right? It's the first thing to be destroyed in a war. It's something that's very costly and difficult to rebuild afterwards, and maintaining them is very politically unpopular. So that's part of why I think this bridge analogy is so timely and useful for people interested in resources and energy and climate change. So thank you very much. I have some contact information on the last slide if you'd like to follow up or have any questions that you can't get addressed now. And particularly want to thank the Renew program for sharing their stories. Thank you.